Senator Joe Manchin, shocked Washington last week when he reached an agreement with Senate Majority Leader Chuck Schumer for what they're now calling the Inflation Reduction Act of 2022. The legislation appears to include roughly $790 billion of offsets to fund roughly $485 billion of new spending and green energy tax breaks. With Senator Manchin on board, all eyes now are shifting to his fellow Democrat, Arizona Senator Kristen Sinema, for which way she is leaning regarding the bill. Joining me now to discuss how this bill will affect average taxpayers in light of the skyrocketing inflation we've all experienced under the Biden administration's policy is Congressman Andy Harris. He represents Maryland's 1st Congressional District. He's a member of the House Appropriations Committee and co-chair of the House Pro-Life Caucus and a member of the GOP Doctors Caucus. Dr. Harris, welcome back to Washington Watch. Always good to see you.
Good to be with you, Tony.
All right. I know I always get a kick out of the deceptive titles that are used for measures. The Inflation Reduction Act of 2022. Apparently, Build Back Better had become toxic. And so now they've come up with this new title, which it just is a pared down version of Build Back Better, as I understand it.
That's right, Tony. It's completely Orwellian to call this, to somehow suggest that this is going to do anything except accelerate inflation is completely Orwellian. Anytime you increase taxes like this, anytime you increase government spending like this, you're going to increase inflation.
So as I've read, and I'm reading the congressional analysis of the bill, we're talking about just around $739 billion is the revenue raised. We're talking about corporate minimum taxes, 15%, prescription drug pricing reform. And as a physician, so what does that mean? How are they saving money on this prescription pricing, allowing Medicaid to go out, to Medicare to go out and negotiate prices? Where's that savings going to be found?
Well, I don't think there are going to be any. I think this is all smoke and mirrors. You know, the assumption is that no one will change any behavior, you know, once you pass this law. But what it does, it takes a very small number of drugs. It controls their price fairly late in the life of the use of those drugs. So the drug companies are just going to do what any rational person would do. They're just going to charge more upfront in the first few years to make up for the price control, the price fixing that the government is going to implement in the last few years. So again, it's savings on paper. I don't think it ever materializes.
Does that have an impact, Dr. Harris, on research for new drugs? If you're taking away the profit incentive to the private sector, what does that do for these drug manufacturing firms?
Sure, it certainly could. I mean, that's the other effect that it may have. The drug companies could choose to charge more in the first few years, but they could also just cut back on research and development. And I think that would be terrible. I think Americans realize that the new categories, specifically of anti-cancer drugs, are fairly expensive to research and develop, but they're life-saving. And again, we have to decide, is it worth it? Or do we think that, again, when government begins to control the price, it will control supply, it'll control, again, it will make research and development much more difficult to fund. And I think Americans' health will suffer in the end. I think this is just poorly thought out.
One other aspect that I've highlighted that I'm trying to figure out, because there's not a lot of definition, and you may have a better handle on this, is they're proposing they're going to raise $124 billion through IRS tax enforcement. Has the IRS not been collecting taxes? I mean, what are they going to do differently to come up with $124 billion?
Well, I will tell you, the IRS has been terrible in the past few years. As you know, a lot of IRS agents don't even work at the office still. It's one of the number one complaints we get now. It used to be veterans complaints and now IRS complaints. So what they're going to do is they're going to spend billions of dollars and hope that through tax enforcement they can collect $124 billion. Again, one would assume that would have been done already. So this is another example of smoke and mirrors. These are made up numbers. This is just an opportunity for the government to spend more. That's it.
Now, the one other aspect of it is $300 billion in this is to go to deficit reduction. But are we talking about an elevated amount of expenditures, revenue expenditures? So, I mean, we're raising more money to spend less, but we're spending more. So I don't see how this all adds up. Maybe you just don't spend the money and then you can reduce the deficit.
That's one way, Tony. I guarantee you one thing. And again, look, the deficit reduction is the supposed, again, the smoke and mirror revenues, 729 billion, versus the spending, which is 300 billion and change. But I will guarantee you one thing, Tony. That spending will occur. That tax revenue may never come in. So I think that again, the deficit reduction is pie in the sky hope. But what this does, it will definitely increase spending by well over $300 billion. That's what got us into this inflationary problem now.
Right.
This will just make it worse.
Now, the Wharton School of Business, the Wharton budget model, University of Pennsylvania's Wharton budget model suggests that this, based on what they see, it will have almost zero impact. It'll actually raise inflationary costs for the first 4 years, and then it will be, again, a very small but insignificant amount, basically zero. So it doesn't do anything to, according to them, really to reduce inflation. So it's only increasing government spending. So how is this going to I mean, this is one of the things the White House has been talking about, in even Senator Manchin, who I have a lot of respect for. I know him. I would consider him not a friend, but an acquaintance. How is this going to help American families?
Well, Tony, it won't. I mean, as the Wharton analysis suggests, in the first few years, it actually increases inflation because it increases government spending. The bottom line is that I don't trust the out years. I've seen this enough in Washington. They make a 10-year projection. What happens in the first few years happens. What happens in the out years doesn't happen. So I think Wharton got it right. In the short run, this will increase inflationary pressure. That's the last thing we need right now in the United States.
You bring up a really good point, Andy, that, you do things on these 10-year models, and it never happens. You get the first couple of years, that's where people spend the money, but the savings never comes in because they change policies before we get to it, and they add more spending to it.
That's absolutely right. And that's why in this case, again, I think that there's no question this is going to increase inflationary pressure. I hope that Senator Sinema sees through this. I think Joe Manchin got hoodwinked. I hope she doesn't. And I hope she realizes that increasing taxes right now is the wrong thing to do. As you know, Tony, taxes paid by corporations are merely passed on to consumers, to customers.
Right.
That will make inflation worse in and of itself, and it's a drag on the economy that we don't need right now.
And it's targeted on energy. I mean, we're looking at tax on oil companies, a tax on gas, natural gas, and so that's only going to drive up the cost for the American consumer. I mean, we do have kind of a spread of COVID that's going through the Senate, so maybe they won't be able to gather 50 to vote on this before they break for August.
Well, look, I hope this never comes out of the Senate, because if it does, it'll be rubber stamped by Nancy Pelosi in the House. And again, this is not the time to spend hundreds of billions of dollars and to raise taxes. It's just a very bad idea.
I think you're absolutely right. Now is not the time. Of course, I don't think any time is a good time to raise taxes. Dr. Andy Harris, always great to see you. Thanks for stopping by on this Monday.
Thank you, Tony.